There is the rule, one of the key principles, it's about the person, not the person in care. But it's hard to know what a person's like when they're in a specialized setting. So if you're in a psychiatric hospital, how do you rate the tool? Or if you're in residential treatment, how do you rate the tool? And so that's a really important question. And it's a little bit complicated. I mean, how many times have you heard somebody say, well, they're doing well in the residential program, they came back in the community, they fell apart? Well, that's not accurate. You're describing a person in a structured setting and they're functioning in a certain way, and when we remove that structure, you see that person. So we need to learn to talk about that person. So that's important, but it's complicated. It's the best way to address this is you understand what somebody was like before they entered this structured setting. So you understand what they're like, what the reasons were that brought them into that setting. And then you look for evidence that they've changed. And what you're looking for is whether there's any justification, any evidence to adjust their initial level of need congruent with anything that might have happened while they'd been in the structured setting. So for risk behaviors, for instance, it's pretty common in a structured setting to move from a 3 on a risk behavior, an urgent need, to a 2. But it's less common to move from a 2 to a 1. Particularly on behavioral emotional needs, it's very unlikely that you're saying treatment is over. However, what you sometimes see is you're able to build strengths, you're able to build resiliency, etc. So what you're looking for then is how were people when they entered this special setting? And is there evidence that they've changed? And you adjust their action levels based on the evidence that they may have changed. They may have undergone a personal transformation of some type. That's why you often see in residential treatment in particular, the actual benefit of residential treatment is building specific strengths. Because that's actually things that you can help change in a fairly sustainable way as people move back out of these settings.